Well, exciting things are happening at UConn Health, including a new vascular procedure that is minimally invasive with a little downtime.
And in fact, UConn Health is the only hospital in New England currently offering it to patients. Here's Melissa Cole now with more.
Dr. Justin D'Addario, assistant professor of vascular surgery at UConn Health, is talking with us about severe peripheral arterial disease, or PAD.
Everyone gets some degree of hardening of the arteries with age. There's certain risk factors: smoking, diabetes, kidney disease. But once you get to the point where you have enough blockages in your arteries that you're cutting off blood flow to your foot, you could ultimately be at risk of limb loss.
Yes, this disease can get so advanced it can lead to an amputation.
Quite frankly, an amputation, it sounds barbaric in modern day, especially if you're unacquainted. But very frequently, when we run out of surgical options and you just don't have enough blood to heal a wound, you wind up having an amputation, if not across the foot, even below or above the knee.
But thanks to new technology, doctors here at UConn Health's Division of Vascular and Endovascular Surgery are literally saving limbs and saving people from having traditional surgery. 70-year-old Maureen Marchetti of Brooklyn, Connecticut, is the first patient here to receive a new procedure called Detour.
This new technology, using just needles and wires, takes stents out of the artery, down the vein, and back into the artery, effectively creating an open surgical bypass without incisions.
Maureen had already lost toes on one foot in a previous surgery for PAD. And when she noticed toes on her other foot turning purple, she was notified she was a candidate for the Detour. It's minimally invasive, the patient doesn't have a long hospital stay, and can resume regular activity in 48 hours.
We'll be avoiding, the stroke and heart attack risk of general anesthetic. We'll be avoiding the wound complications, right? Any traditional incision could get an infection, it could break down, you could pop your stitches. And we spared a hospital stay. So folks on average spend about 3 to 5 days in the hospital after a bypass. The procedure we do now, you could go home as early as same day.
Maureen did smoke, which Dr. D'Addario says is the biggest risk factor. Here are some of the warning signs.
A lot of times patients will feel cramping in their calves when they walk. We call that claudication. The other presentation, sometimes, unfortunately, the first sign of blockages in the blood vessels to your leg is a wound.
Dr. D'Addario says quitting smoking should be at the top of people's lists.
If people didn't smoke, I'd be out of business, and honestly, that'd be a noble problem to have. So I'd much rather not have a job than see patients that smoke. So that's the #1 risk factor. Any bit you could cut benefits you more than just your legs and your blood vessels, but like we discussed, lung issues, COPD, cancer, that's probably the best thing you could do.
And here's one more piece of advice.
Get a second opinion. I tell all my own patients, if you would speak to more people about buying a car than having surgery, you should probably speak to at least one more person before you have surgery.
Some good advice there. Wow,
Absolutely.
That's incredible information about the smoking. To learn more about UConn Health's Division of Vascular and Endovascular Surgery, you can visit the website. It's health.uconn.edu/vascular-surgery.